Now to the pandemic tonight, with the FDA expected to authorize a vaccine for children 5 to 11 at any moment. Tonight, news on a potential fourth shot, another booster for immunocompromised people. The CDC today saying a fourth shot may be needed 6 months after your booster. It comes as millions of those child-sized doses are being ready to be shipped out to waiting clinics like this one at the Santa Clara County Fairgrounds in California and pharmacies like this one in Milwaukee, getting ready for children. If CDC approval comes as expected next week, millions of children could be fully vaccinated by Christmas. Here's Whit Johnson.
Just as booster shot availability expands to 70 million Americans across the country, tonight word of a potential fourth shot for one vulnerable group. The CDC now allowing people who are moderately and severely immunocompromised, about 3% of the population, to get another shot at least 6 months after completing their third mRNA vaccine dose.
This fourth shot is essentially equivalent to a booster for immunocompromised people, but does not mean that the general public is looking at a fourth shot anytime soon.
It comes as preparations are underway to roll out the first Pfizer shots for 5 to 11-year-olds, expected to get the green light next week. In Santa Clara, California, this vaccination site all set up for young kids.
Good afternoon, Hyatt Pharmacy.
And across the country, pharmacies and doctors are busy fielding calls from parents.
We have to think of it almost like a completely separate, completely different vaccine when we're treating children.
The doses for younger children will be 1/3 of the amount given to adults and will come in special pediatric vials with smaller needles and orange caps. Pfizer's study found that 2 shots were nearly 91% effective in preventing symptomatic COVID. Still, many parents are hesitant. Only 1/3 saying they will get their 5 to 11-year-olds vaccinated right away. Some want to see more research.
The guilt would be tremendous. If I was risking something and he had a reaction to, that's something that I have to take responsibility for.
But health officials say the vaccine is safe for kids, and the real risk is COVID.
I think there's urgency because we're seeing disease in children. We've seen deaths in children.
And Whit Johnson with us tonight. And Whit, late today, the CDC giving us a clear picture of when these shots could be available for children 5 to 11.
David, the CDC advisory panel announced that they will meet next Tuesday, and then they will vote on the Pfizer vaccine recommendations in kids 5 to 11 years old. The CDC director will then have the final say, and we could see the first shots going into arms for these younger children as early as next Wednesday. David?
A little sooner than they thought. All right, Whit Johnson, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.